again. Good to see you. Hello, everybody. I love to see Red in the audience. Thanks so much for being here today. SeniorCare is a prescription drug assistance program for Wisconsin residents who are 65 years or over who have met the eligibility criteria. With a $30 annual fee, co-payments ranging from $5 to $15, and no gaps in coverage, SeniorCare provides more comprehensive and less expensive expansive coverage than Medicare Part D. Since its implementation in 2002, SeniorCare has delivered comprehensive outpatient drug benefit to over 290,000 senior residents across the state and continues to be a popular and successful program. Wisconsin Department of Health Services requested a 10-year renewal of its waiver for the SeniorCare prescription drug assistance program. On Friday, April 12th, the Centers for Medicaid and Medicare Services notified the Department of Health Services that it has approved a 10-year expansion of SeniorCare. And that great news came right after the temporary extension through the month of April, so we're covered. Folks in Wisconsin have repeatedly said that they are concerned about the cost of prescription drugs. We hear it all the time on our listening sessions across the state also. That's why my budget is bringing transparency and accountability to drug pricing and why we've worked hard to protect the SeniorCare program. We know how much seniors rely on this program to choose prescription drug coverage that is right for them at the prices they can afford. Nearly 50,000 Wisconsin seniors depend on this program to help with the cost of their prescription medications. A 10-year approval from the federal government is rare, and I'll tell you this, I am so thankful because it speaks highly of the quality work that our staff who are dedicated to preserving and improving the health and well-being of Wisconsin residents. So we're not only thankful for the great work of the staff of the DHS and others in the state government, the advocacy of organizations such as My Home, AARP, Healthy Aging, the Greater Wisconsin Agency on Aging Resources, as well as bipartisan congressional support will keep this program going for another 10 years and beyond. So it's great to be here to talk about it, but I want to turn it over at this time to Secretary-designee of the Department of Health Services, Andrea Paul. There's Andrea. There you are. Good to see you. Behind you.
Thank you, Governor Evers, for your leadership on health care and your efforts to make prescription drugs more affordable for Wisconsin seniors. I am Andrea Palm, the Secretary-designee for the Department of Health Services. I'm so happy to be here today to celebrate the 10-year extension of the SeniorCare program. We were chatting before the governor arrived about the history and the battles and how hard folks have fought to keep this program funded and in existence. And so this 10-year extension is really a major milestone in protecting the program moving forward. Wisconsin has a proud history of innovation in healthcare, and this program is yet another example, as the governor mentioned, of the great work we can do on a bipartisan basis together. SeniorCare provides access to a robust network of pharmacies across the state and provides at least as good or better coverage than the Medicare Part D program. With the approval of the waiver, seniors will also have access to medication therapy management services that provide in-depth analysis by a pharmacist of a member's health and their medications. Before this extension, we'd get calls at the department from worried clients at the end of each month who wondered if their benefit would survive, if it would be available for them moving forward. This extension relieves that stress for folks for another decade. I would also like to echo the governor's remarks and thank DHS staff for their amazing work to secure this extension. This 10-year approval is an extraordinary accomplishment. Thank you to the dedicated team at DHS. I would now like to introduce Helen Marks Dix, who's with us today from AARP.
I'm Helen Mark Six from AARP Wisconsin, and I have to say that AARP has been involved in senior care since its very inception as an idea, helping it get it passed, helping support it every time it was attacked, and making sure it's available for people. I have with me today one of our members who joined the program a decade ago and has been using its benefits and will continue now happily for another decade without having to worry about it. I also have with me Donna McDowell, our state president, who was actually the head of the aging department at the aging division at the time that this was originally planned. It is a great program for seniors. I've never understood why the national government didn't take it over and make it a national model so that people in other states could have it. It is really extraordinary, and we thank the work of the department and the governor to make sure we get this extension because it's very important to us. Thank you.
And thanks, everybody, for being here. Obviously, a very important day for not only the seniors of our state, but again, I just have to have a shout out. Too often we forget about the hard work that our state employees do, and this is one of those occasions where we do not want to set that aside. We want to thank the Department of Health Services and the employees that really worked overtime to make this happen. So thank you. Have a great day.